Okay, so if you made it home, you're watching our tape by now. A couple things. All this red tissue in here is called synovitis. That's inflamed tissue. That's where most of your pain is actually coming from. And then our goal is to find out what's causing the synovitis and try to address that. So all that red stuff that looks angry is angry. This is the arthritis part here. Okay, this is real. This is not smooth. It should be smooth here. You've lost the cartilage that lives in this area. We'll show you some normal stuff here in a minute after we get cleaned up a little bit. The meniscus is this C-shaped structure to the left right here. We have not gone back yet, looked in the back, but I want to point out this area because this is real. Okay, so what this is normal tissue here, normal cartilage. We drop into this pothole here where you've lost the cartilage that normally lives here. So when people say, can you go in and scrape out arthritis, you're going to tell them now, because you're educated on this, that arthritis is the loss of the cartilage. You can't scrape out something that's not there. Now these loose flaps of tissue, we can certainly, quote, clean those up, unquote, and try to remove these so they're not floating around in here. But this is a natural process of progression down the road as far as the arthritis components. This isn't going to solve this long term. It may give you some short-term relief while you're working on other ways to manage the arthritis, which is get smaller, stay active, nutritional supplements, etc. Okay, so we're going to start by getting rid of this red tissue, this synovitis here. So this is called a synovectomy. All right, and this allows us to kind of see a little bit better too. Okay, can we straighten the knee out a little bit? And this extends all the way up into here. You can see this, we're going up under the kneecap. And you can see that red tissue is just about everywhere on the inside part of your knee. This is kind of indirect evidence that you weren't making this up. We always believed you. But you can see where it's rubbing on the stuff to the backside of the shaver. Okay, so that irritated tissue gets thick, starts to rub on there, gets a little more irritated and thick, rubs a little bit more, and it's kind of a snowball going the wrong direction. Or a snowball going the right direction. Building and building. Okay, so we're going to clean this up. All right, and then we're going to go with a little different tool here in a minute and look at that. You can bring it down now. Or look at the meniscus a little more clearly. Okay, so this kind of extends all the way around. Again, this is pretty normal in our normal day. Okay, so this isn't a hateful looking thing. It's just what it is. I hope my knee doesn't look like this, but it's very common. If we do 7, 8 of these in a day, we're going to see this most of the time, especially in our age group. All right. So we'll get that cleaned up a little bit. That's your ACL right there, in case you were wondering. It looks normal. We're going to go to the lateral side. This is going to show us normal. Okay, there's the normal cartilage there. We can see the lateral meniscus over here, and that's normal looking. So you see the difference if you rewind the tape. Actually, we're going to go back over there anyway. You'll see the difference between nice, smooth, new-like cartilage, nice and smooth, normal meniscus there. And as guys, we almost invariably always wear out on the inside. Okay, so you can see the loose flaps of cartilage hanging down. Those are going to behave like a meniscus tear. Okay, so they're going to be floating around in there. You can see some pieces there going right in front of our screen. Can you grab the foot? We got to get our shaver back in here. Let it bend a little. There we go. All right. Now, using the same device, our goal is to try to get these loose pieces out of here without damaging, the cartilage, the normal stuff that's left behind. So we want to be a little careful that we're not doing more damage. But this is going to act just like a meniscus tear as far as how you feel. Sharp, stabby pains, intermittent giving way. Mechanical, what we call mechanical knee pain. All right. So we're going to get all those little loose pieces out. Now it doesn't leave, this is a fair amount of area there. We're going to go in with our little Arthur wand, get the knife back. Sorry, we're kind of sometimes get a little boring with I try to keep talking to you so you don't go turn the channel on me. So that's the meniscus back there. So we're going to probe back in there and make sure there's nothing hanging around. But I think the culprit is the stuff here in the front. And this little device here will help us kind of smooth that out. Again, our goal is to not do the least amount of damage to the tissue around it, so that the rest of the cartilage has a chance to kind of stick around for a while for you. But you see that's just very, very soft. Normal cartilage doesn't respond very well to this device. But again, we're trying to get those flaps out of there. So if you were wondering what arthritis looks like in the knee, this is it. Okay, and this goes way back to the back. Again, very normal pattern, not unexpected based on your studies. And we're doing this because of the mechanical complaints you had, the locking, the sharp, stabby pains. If you have arthritis pains, it's usually less acute and more gradual as the day goes on. And if that's the case with you, we got some plans for you as far as therapy, potential braces, etc. But the surgical treatment for this down the road becomes knee replacement. Okay, so if there's a threat, let's try to avoid that and work on other modalities. Okay, so once we get this taken care of, we're going to need to go back and make sure that meniscus is okay. And we got a little probe. We can go back there, an extension of our finger, and we actually have a pretty good look. Sometimes in the big guys it's tight back here. So this is the meniscus in the back, and that is torn back there. You can see there's a piece flipping around back there. So we're going to trim that back. We'll need the punches. But I think, again, this is part of it, and probably the MRI got us to here, but this arthritis piece is the thing that's going to be the issue for you as you go down the road, okay? So we're going to go back and trim out that piece in the back. The shaver back a sec, yeah. Just get a little bit of this is on the downside, so it's kind of on both sides of the knee, which just kind of use this to smooth out that area. And you can see the transition zone from normal tissue to abnormal. And we don't, again, try not to damage the normal stuff. Now, if you've heard the term microfracture, you're saying, why aren't you doing that? This lesion is just too big. And we could do it, keep you off of it for 8 weeks. It wouldn't really solve the problem. So I'm going to go back. Now we got a little device here. This is a little more macro, and we just want to get that torn piece out of the back. You can see it flipping in there. And then we'll take the shaver back. We want to clean up our mess. I'll take the punch back a second. Sorry, I'm not telling any stories today, am I? I don't really have any today, although the weather looks bad out. I guess we could talk about the weather. We could talk politics, but I've learned that's a bad thing. Never know. So we'll stay out of that. We can talk about Northmont football. New staff this year, new coach. New beginnings. Yep. All right, so let me have the probe here a second. And I think we're good in the back. So we've got all those little frayed pieces coming out. All right, so we're going to trim up that little area right in the front. We have the shaver back, so there's not a sharp edge there for you to trip on. Okay, right there. And then we're done, okay? So when we see you back, we're going to ask you what you remembered from this, and I want you to get this in your head that the major issue here was the arthritis part, okay, not the meniscus tear part. That was a player, but this arthritis piece is what's going to bug you down the road, okay? All right? So we will see you, if you rewind, you'll see the beginning, now you see the end, and you see the difference there of our quote, clean up, unquote. All right? We'll see you next week. Get therapy started then, and call us if you need us.